Hello, welcome to The Long Road. I'm your host, Chris Roberts. And today we're going to be a little bit more upbeat compared to last week when we were talking about the special surprises in the fiscal cliff. Today I'm going to be talking about Social Security and Medicaid, Medicare. I'm not going to touch Medicaid. Trying to give a little bit more information and trying to put it in perspective. And I just thought it was kind of coincidental. I had done my homework on Medicare and Social Security, and I just so happened to be listening to Rush Limbaugh, and he was talking about Social Security. And it was kind of amazing how much misinformation that he was providing on Social Security, so I'm going to help try to clear that up. But a few little notes that's going to be happening in the near future concerning Social Security. On March 1st, 2013, only a month and a half away, almost everybody who collects Social Security will have to get their payment electronically. Which means either you'll have do a direct deposit, or you'll get a Address Express prepaid debit card, or basically an EBT card. And that with the EBT card, I don't know if they're going to label it as an EBT card or how the government is going to label it. I know in some cases, in some states, banks like MasterCard and Visa and other ones were trying to get the debit card business because, of course, with anything a private industry does, there'll be a fee, and I don't know how much you would lose for the fee, or I don't know how much it's going to cost for you to use the debit card, or how much it's going to cost to check your balance or withdraw. And I'm not saying it's going to be fee-free or what it's going to be, but I think people would need to check on what they're going to do. Do they take a direct deposit or do they get it on a prepaid debit card? But just remember, anything that a business or a bank does for your convenience costs a lot of money. The only exceptions, basically, there's about 63 million people collecting Social Security checks. About 58 million of them will have to go electronic. There'll be about 5 million hardship exemptions. And basically, to qualify for a hardship exemption and get a hard check, you're going to have to be 90 years or older. And just because you're going to be turning 90 in the future doesn't mean you'll be able to go to the hard check. It is basically, it's for people 90 and over right now, and each year the number of those exemptions will go down. Basically, the key is the federal government wants to ensure that everything is done electronically. And so if you have any questions, one of the website to go is godirect.org. Again, godirect.org. They'll be able to answer a lot of your questions. If you have a checking account at a local bank or the credit union, ask them and they can get you the paperwork for the direct deposit. If you don't have the internet and you still have questions, the number to go is 1-800-333-1795. Again, 1-800-333-1795. And I think it's pretty critical that you start working on it this month, and because normally it takes a little while for a direct deposit to kick in. And so it's mandatory come March 1st, 2013. And you don't want to come March 1st, 2013 expecting a check and not have a check. And so, again, either godirect.org if you have one internet, or 1-800-333-1795. That's the toll-free telephone call to get the information and know how to do it. And again, if you don't want to do either one of them, go to your local bank, go to your credit union, and I'm pretty sure they can help you out. Now moving over to the VA. Come February 1st, the VA will no longer issue cash for travel. A lot of people go up to, say, White River Junction, and they'll get their cash and they'll pay for gas coming home. Well, basically, you have to fill out a direct deposit form because the VA will no longer cut you a check, will no longer pay you cash. And so you go up to a doctor's appointment, you rate travel pay. Again, basically, you have to be 30% or higher and service connected, and a few other rules. So if you're going up there on a light tank of gas and counting on the money to make it back home, you're going to be in for a rude surprise because you're not going to get the money. You're still going to have to go in and fill out the form to rate your travel pay, because if you don't fill it out, you don't get the money. And if I remember correctly, you have up to 30 days to fill it out to get the money. And basically, you should be able to expect it 3 to 5 business days after your appointment or after you fill out the travel claim, 3 to 5 business days before it shows up into your account. I haven't been able to find out what's going to happen to the individuals that don't have checking accounts or savings accounts. There's always a few people that, especially New Hampshire, Vermont, Maine, we're not very trustworthy financial institutions. So you're not going to be able to go, you're going to have to come up with some way for some place for the government to electronically transfer your funds in. That's the way. Basically, if you're 30% or higher, you're collecting a monthly disability check from the VA, so it makes sense for you to put the money in there, that same place. Another change on travel. How much you're going to get paid for travel will have nothing to do where your doctor is. So, for example, I have a primary care doctor up at White River Junction. If I drive up to White River Junction, round trip, I would rate $52 for travel. But for somehow or whatever, the VA will charge $6 as a cost of printing out the piece of paper, one person initialing it, me bringing it over to the cashier, and the cashier paying me $46. Well, one of the things that's going to happen now is if I'm going to my primary care doctor in White River Junction and she says, okay, I just want to sit down and talk to you, and we're going to give you a flu shot and we're going to give you some blood work. Well, under the new rules, they can go, if they go and say, wait a minute, that blood work and that flu shot could have been done at Keene on Marlborough Street, I would get credit for 2 miles, which would be 80 cents, but it would cost $6 to process it, so I wouldn't get any travel. Even thought I went up to White River Junction to see my primary care doctor. If I had to go for an x-ray and they say, well, you know what, that x-ray could be done in Brattleboro, then they would say, because the Brattleboro VA, you would rate $16 in travel, but we would take $6, so you'd get $10. And so this is where the confusing part is going to get for a lot of veterans. It will not matter if your doctor is in White River Junction. And if you've had a primary care doctor, it will no longer matter if that doctor is residing at White River Junction. If you go and visit your doctor in White River Junction and you live in Keene, basically, if that same service, those same tests can be performed in Keene or Brattleboro, that's all you're going to get paid. You're going to get paid for Keene or Brattleboro. And you might go and say, wait a minute, if my doctor is in White River Junction, if I don't see her, how does she order an x-ray? And if I go and she orders an x-ray and the x-ray is taken in Brattleboro, okay, then I have to go back to White River Junction to so she can read the x-ray or tell me what's wrong or prescribe something. So basically, I would have to make 2 trips up to White River Junction, have the x-ray in Brattleboro, and so instead of getting paid for the 2 trips up to White River Junction and 1 to Brattleboro, I'll get paid for 3 trips to Brattleboro. So basically, and in a lot of cases, a lot of veterans will actually be paying out of pocket for transportation costs. Or, as I was told today when I was up there, is, well, just take the van. And as we all know, and some of us, you can take the DAV van. You may have a 10 o'clock or 11 o'clock appointment, but you may have to leave at 6:30 in the morning because there's someone with an 8 o'clock appointment, and then you're going to have to spend the day sitting down, sitting around, wait until the last person. And if that last person has a 1 o'clock appointment, you may not leave until 2:30. So you may have had a 15, 20-minute appointment, but you may be going from 6:30 to 4 o'clock. You know, not a very efficient use of time. And to me, I know I'll tick off some people. When you're a van with 8 or 9 people and some of them smoke, you know, you end up catching sick, or because the smell is irritating, or if someone's going up to White River Junction, or 1 or 2 of the people are really sick with the cold or flu, and so you're in a trapped container, and so not only do you lose a lot of time for a short appointment, but you also run the risk of getting sick because you got smokers on the van. They don't smoke on the van, but as anybody knows, if you're around a smoker and you don't smoke, it can be quite irritating. Or, like I said, if someone has the flu or the bad cold and they're hacking up a lung for an hour and a half, that doesn't really make you comfortable. And so, to me, I find it quite questionable why I would have to go if I want to go see my doctor at White River Junction, why would I have to pay out of my own pocket? And the other question is, these small clinics, they don't have the amount of doctors. So if I go and come down here and say, okay, we want a new primary care doctor in Keene, so that's what we're going to do. Well, I go in and I had cancer, and I said, okay, they said I had to have a CAT scan. And so I have a CAT scan, and the results come back and say, well, you know, you got a growth in your chest. Well, oh yeah, come back and see us in 6 months. And it's like, wait a minute. And so if I go in and get it done here, then I have to wait even longer to get a doctor up at White River Junction before I get over to a specialist. So when they go and say we tried to get an appointment within 30 days, that isn't true. And I'm a primary Priority 1 veteran. And so those are some of the things. And so there's going to be a number of veterans who are not going to be able to afford to drive up to White River Junction to make their appointments and stuff. And so, again, the quality of their medical care and the quality of life will drop off drastically for some. Okay, what we're going to do today, and I'm going to move on to Social Security. And for the people who get their Social Security statement, and this is a statement that's been available since August 16, 2010. Social Security is the largest source of income for most elderly Americans today, but Social Security was never intended to be your only source of income when you retire. You also will need other savings, investments, pensions, or retirement accounts to make sure you have enough money to live comfortably when you retire. Well, you can go in and tell people over and over again, you know what? Social Security was never intended to be your only source of income. Well, when I was growing up, I was told that over and over again. It was a three-legged stool. One was Social Security, one was a pension, and one was individual savings. Well, as we've gone over the last 10 years, for example, the last 5 the worst, a lot of companies have done away with pensions. Plain and simple. For example, FedEx, probably about 6 years ago, said, guess what? We're not going to give anybody any more pensions. If you're in, you're in, but we're done with the pensions, and so you can do your own 401, and then we'll give you a portable pension plan, so when you leave, you can take it wherever you want to go. So that that leg of this three-legged stool was cut off for the majority of the people, so there only left 2. So the 401. But a lot of people have lost their jobs, and because they lost their jobs, they've been digging into their 401 just to be able to survive. A lot of companies stopped putting money into 401, and I can't remember if it's AT&T or IBM. I think one of those have decided that, I think it's one of them, or if not, one of the major corporations have decided that they will no longer do a 401 match as you pay in. What they'll do is and say, if you're working December 31st of that year, they will then match the normal percentages based on what they said they would. So if you're getting ready to retire, for example, and you work 11 months for the company and you retire December 1st, all the money that you put in for those 11 months doesn't get any match. And so the company knows that people will come and go, people will retire, and so they've said they're doing it to make themselves more competitive in the marketplace, but it just adds to their bottom line. So what's happening right now is that for the great majority of the people, the third leg has been cut off. And so for a lot of people, unfortunately way too many people, Social Security is really going to be their only source of income. Because if you've been putting money away in CDs or savings accounts or bonds, Mr. Bernanke, in his goal to keep government borrowing costs down, has ensured that we get like 0.1% on return. And if you're getting 0.1 or 0.2% on return and inflation is 1.7, that means you're losing money every month when you put money away. And so 2 of the things that was stated, in 1960, the Supreme Court ruled that entitlement to Social Security benefit is not a contractual right, which means that the government doesn't enter into a contract with you. Plain and simple. It's not like if I go in and cut a contract with a company and says, you will give me 5% every month, and I'll put 5% in every month, and then when I'm turned 60, I will get $1,223. That's a written contract. Well, Social Security doesn't do that. We do not have that ability. And in 1936, what they stated was, when you look at the bill, that Congress has the ability to modify Social Security any way they choose, and they have the sole right to do that. Okay, right now, Social Security replaces about 40% of an average wage of an average wage earner's income after they retire. And that's in publication number 505-10024, Understanding Social Security Benefits, dated March 2012. What I've done is I've gone through a whole bunch of stuff to come up with this information. And in 2011, 23% of elderly married Social Security benefits received 90% or more of their income from Social Security. 1 out of every 4 married couples that are on Social Security receive at least 90% of all their income from Social Security, which means it would not be surprising if 10 or 15% of all the people on Social Security, the only income that they receive is from Social Security. Unmarried widows, people who have never married, 43%, or basically 2 out of every 5, receive 90% or more of all their income from Social Security. So I could really very easily, have no problem stating that at least 1 out of every 4 unmarried individuals collecting Social Security receive 100% of their income from Social Security, which is extremely, I think, really dangerous and haphazard. And again, when people go, and I don't think very few people understand how Social Security works. Social Security is basically a security net, but it doesn't pay the same to everybody. And the unfortunate part is, the lower your income, how do you put this? I'm not saying unfortunate. To get a higher percentage Social Security check, you've had to earn very little when you were working. And so basically, you were working paycheck to paycheck, and then when you get to Social Security, you get even less, but you get a higher percentage. And so I'm going to do my chart this time, and it's going to be much cleaner than last week. In 2011, if you're averaging $15,000, these are all Social Security numbers, if you're averaging $15,000 a year for your lifetime, you would pay $86,000 into Social Security over the course of 44 years. And that's including the average interest return. So that's interest that you would have gotten based on the average return. And so you would get a check for $10,128 a year. Basically, 11.8% of what you put in over a lifetime. But for the average, so what would happen is, basically, Social Security replaces 67.5% of what you were earning. And so, and what would take is, it would take you 8.5 years at this rate, including inflation and the normal standard CPI increases, for you to recover the $86,000. So if you retired at 65 and you lived 73.5 years, you're at the break-even point. Okay? Now, if you make $50,000, you would pay, again, including interest, $285,000 over 44 years, and you would get a check of $21,324, or basically 7.5% per year of what you put in. But this would only replace 42.6% of your income. So when you look at the low wage earner, they get 67.5% of their income. So they've lived a low standard of living, but their standard of living doesn't drop off dramatically. I would not want to be in that group, but statistically, looking at just the numbers, they don't have much of a drop-off. But if you're made $50,000 and at 7.5%, you've got basically a 57% drop off, or $29,000. That's what your income, yearly income, would happen in 1 year. When if you retired at 65, there's the following year. So it would take you 13.4 years. So you would have to live to 78.4 to collect back your $285,000. Now, if you're at the high end and you made $110,000 per year, you would pay $627,000, again including interest, into the Social Security fund, and you would get a check of $31,260. Basically, you would get 5% a year of what you paid in, and that would be replacing only 28.4% of your income. While this number is really low, but if you've made $110,000 a year, unless you're stupid or unless you splurge the money on vacations and 70-inch TVs and $40,000, $50,000 car, you're going to have a 401 or 403 or an IRA or some type of retirement plan to give you the second leg of your stool. You may even have a pension plan that may even give you part or all of the third leg of the stool. So you would have disposable income here to help make up. And so in certain cases, if you've got the 401 or you've got part of the pension, that second and third leg would bring your number up, and so you would have to replace less of your income than the middle earner. So the lowest earner has kind of a drop off, but not that small. The higher earner has a drastic drop off, but they'll have leg 2 and 3 of the stool to help make up. This is the individual that's going to run into a problem, because they're not going to have the opportunity. They may be living paycheck to paycheck, trying to feed their family, pay the mortgages, because a lot of people now, when they retire, they still have a mortgage. For example, if you're living in Keene and you have a $200,000 house, you're paying $6,000 a year on taxes. And if your income dropped down to $21,000 and $15,000 of it, $6,000 goes to taxes, you're already down to $15,000. And we haven't even got to the Medicaid part of it, so Medicare part. So you're in a hurt locker, and that's going to be tough. This individual takes him 20.4 years, or he'll have to live to 85.4 to break even. And so the individuals that make $110,000 or more, the majority of them, when you look at life expectancies, will never collect the full amount that they put in. And so while I call them as insurance premiums, Social Security premiums for the high end I use to offset the premium costs and pay greater benefits to the individuals on the low end. And so when you give an example, the average benefit for right now is $1,229, which comes out to $14,748 per person. If you made $15,000, right now, if you're over 65, according to United States Census, the poverty level is $10,788. So these individuals collecting Social Security, Social Security keeps them in poverty, and basically right now, 9% of all the people who collect Social Security are in poverty. And but when you go and compare that to the 1950s, in 1950s, 36 to 39% of all the people on Social Security or the elderly were in poverty. So there's been major changes, and basically poverty level has gone down to from the mid-30s down to 9%. But there's been changes in Social Security. The costs are going up. The high end is based on inflation. And this is one of the old myths they used to have. In 1980, it took 2.8 years to recover all the costs that you paid in to Social Security. In 2003, it jumped up to 82.4. And if you were to retire in 2020, you'll have to live to 86.6. And so as people get older and you get closer, more and more closer to retirement, you're going to have to live longer. And so both of these numbers, as we'll see, for men exceed the life expectancies. So, and little trivia question. When you first joined Social Security, you could get a lump sum payment. And the first individual to get a lump sum payment was Ernest Atkinson of Cleveland, Ohio. He retired one day after the start of the program. He paid in 5 cents that one day, the day before he was 65. So the United States government, through the Social Security Administration, provided him a lump sum retirement check for 17 cents. And so that's a little trivia question is, so if anybody asks you, the first individual to get the lump sum was Ernest Atkinson. He was one day in the program and he got a lump sum check of 17 cents. I hope it went farther in 1936. And so clean this up a little bit. If you're 40 years old right now, if you're a black male, and you retire at 67, and this is 40 and retiring at 67, your life expectancy is 73.2 years. Not very good. If you're a white male, you're going to go to 77.9. You're a black female, you're going to go to 78.7. If you're a Hispanic male, you're going to 80.2. If you're a white female, you're going to 81.8. And if you're a Hispanic female, you're going to live, you expect to live to 84, that's 4.3. So when you go in and look at the numbers, basically the only person that group is supposed to be able to make it is Hispanic women who expect to, if you're a 40-year-old Hispanic woman today who expects to retire in 27 years, is expected to collect Social Security for 17.3 years. That's the medium, the life expectancies. Of course, we all know there's a lot of basically female, white female and Hispanic female, even black female, even though it's almost a 6-year difference between black females and Hispanic females. A lot of these women are going to end up living on their own as Social Security recipients, and a lot of them, 90% or more of their income is going to come from Social Security. So, especially this group and this group, the black females and Hispanic females, they're going to age into poverty. And there's more and more at a lower rate, but more and more white females are going to live until they're into poverty. And that's why if you go, I beat up on Walmart and Target and some of the other places, that's why you go and see that more and more older women are working. And according to the Wall Street Journal, 9% of all the workers in the United States right now are 75 years and older. And one of the biggest reasons that Franklin Roosevelt pushed for Social Security was because socialism and communism was a big thing. In the United States, we were worrying about some revolutions and some takeovers. And one of the big things you have is when you have males in 14 to 25 and they don't have jobs, they can be a problem. That's as you see the Arab Spring and the other ones. It's college-educated males, unemployed males, whether it's in Libya, Tunisia, Egypt. And so what Roosevelt did was he gave Social Security to go in and say, hey, you older people retire and I'll give you money. And the whole purpose was to create jobs for younger unemployed men. And so right now we have more people 65 and older working than any time since the 1930s. So because of the people aging into poverty, more of them are working, and that becomes the great problem is if a female is 75 years old working at Walmart because she needs the money to stay out of poverty, who loses their job? That means someone much younger can't take that job. And a lot of times in the past, it'd be 16, 17, 18, 19, 20-year-old people would take that job. And one of the highest unemployment rate going right now is because it's in the 16 to 25 age group. And that's the sad part of it. Healthcare costs. Everybody's been talking about Obamacare and a whole bunch of other things going on. Well, we do have a little problem with healthcare. In 2010, according to the American Medical Association, 30% of primary care doctors have either restricted the number or will no longer take any new Medicare patients. So 30% of the doctors will not take new Medicaid patients, or if you're being kind of little blunt, they won't take another Medicare patient until someone dies off. 35% of Medicare beneficiaries say they're struggling to find a new primary care doctor. 1 out of 3 have trouble. If you don't have a doctor, or you move and you're trying to find a doctor, 1 out of 3 will have a hard time finding it. 25% or 1 out of 4 people have had trouble getting a routine care appointment. Again, so you run into the problem is the doctor goes and says, I got to pay off my student loans, I got to make money, and so how many Medicare patients do I take to maximize my income? And if I have someone who has insurance paying the full boat, do I take them before I take a Medicare patient? And a lot of times they'll take the people that are paying the full boat, so because they want to make money. And when Medicare, in 1980, there was 28.3 million people on Medicare, and the Medicare bill that the federal government paid was $33.9 billion. In 2010, there's 47 million people on Medicare. Basically, that's 19, that's about a 40, no, it's about an 80% increase. Well, but instead the bill is $514 billion. That's what the federal government paid on Medicare last year in 2010. And Fidelity Institute on health on retirement costs says a 65-year-old couple retiring in 2013 would need about $240,000 to cover future medical care costs. This does not count long-term health care. It's based on retiring at 65, not earlier, because if you retire earlier, you don't get Medicare. Okay, what this is made up is deductibles, co-pays, premiums for optional coverage for doctor's visits, prescription, out-of-pocket, and things like hearing aid, glasses. And so you got Part A. It covers inpatient hospital care for most people, stays in skilled nursing facilities, and healthcare visits and hospice. For most people, no premium, but there is a $1,184 deductible per year. Then comes Part B. For the average person, it's for doctor visits, outpatient services. For the average person, it's $104 per month. And so basically $1,259 annually. So now all of a sudden you're up at about $3,100. No, wait. I should have added, it's for $2,300. Then there's Part D. So it's about $40 a month or another $480. So you're about $2,800. Okay, which only covers the first $2,970. Okay, the $7,450, the gap. The Social Security, Medicare will pay 47.5% of name drugs and 79% of generic drugs until that number is up to 47.50. So basically, add $2,000 extra if you're really sick and you need a lot of drugs. Okay, then if you want to go, it says, well, I don't want to take the risk because I want to be able to do it. You can say average hospital stay is $9,200, but then you can pay $2,120 for Medigap insurance. So that's $6,930. Then you can get rid of this deductible and some of the other ones, but you can very easily pay $5,000 for your Medicare stuff per year. So if you take that $5,000, then you take the $6,000 for taxes, property taxes in Keene, that's $11,000. And as a couple, you're only making $23,000, so you have $12,000 to live on a year. And with that, you got to do food, you got to do insurance on your property, you got to pay for your car, you got to pay for gas, all this other stuff. And this doesn't cover eyeglasses and exams if you need hearing aids. And there's a whole bunch of stuff that is not covered. And what makes it worse, when you go in and look at the other numbers from Social Security and you look at some of the costs, the actuaries from the Employment Benefit Research Institute states 60% of workers say that single workers or them and their spouse have less than $25,000 for retirement. This doesn't count the value of the house or a pension plan, but 70% of the companies no longer offer a pension plan. So, bingo. Yeah, because in 1988, 66% of the companies of large firms had a pension plan, and they also had health care plan. Right now in 2012, 25% of all the companies have pension and health care plans for their retirees. And so that is making it really, really kind of tough for a lot of people. And of course, people always say, well, there's inefficiencies in Social Security, there's corruption in Social Security, there's fraud. Well, sometimes it's pretty hard to say no without a straight face. You remember in about, I think it was 2010, 2011, we all got a check from Social Security, like $250. Well, a government accounting office says 63,481 people who received the check were dead. Their deaths had been reported to Social Security. So Social Security sent out checks to 63,481 people that they knew were dead, that had been reported to Social Security. Social Security had no way of knowing how many checks were sent out to individuals that were dead but were not reported to Social Security. For a local issue, some of the people may remember Norma Ray, who is at the Maplewood nursing home. For a while, she was the oldest person in the United States. Well, for somehow, Social Security sent the checks out to over 8,000 people who were older than Norma Ray. And one of the individuals check was sent out was born in 1873, who was 136 years old when the Social Security sent him a check for $250. I'm pretty sure in 1873, if he would have got a check for or even 1900, if he got a check for $250, he could have really invested it and buy some big property. There was a man who was dead for 34 years and had left the United States before Social Security was inactive, hadn't been in the United States for about 75 years, plus he was dead. He received a Social Security check too. And and in 2008, about 7,000 federal employees who were working part-time, full-time, collecting a federal government job, were also collecting SDI, Social Security Disability insurance at the same time. And here it is, the federal government is supposed to be cross-checking. So you kind of go and say, wait a minute, if I'm getting a check from the federal government, that means I'm working. And so if I'm working, why would I rate Social Security disabilities? And another one in 2010, the federal government, the General Accounting Office, did a cross-check and found that 62,000 people who were receiving Social Security benefits for unemployability somehow either were issued or reissued their commercial driver's license. And so if the commercial driver's license, if you have serious, long haul and all that other kind of stuff, but if you have serious disabilities, you can't get a commercial driver's license. But 62,000 people in 1 year got a commercial driver's license or had it renewed while collecting Social Security disability. That's what people find frustrating, and you really can't blame the people for that. Now to go to Rush Limbaugh. Rush Limbaugh stated that FICA funds are the only thing that support Social Security. Well, no. For example, basically right now, the federal government has taken $2.7 trillion out of Social Security because the law says it has to invest it in federal government. So the federal government owes $2.7 trillion to Social Security. So every year, the federal government pays back Social Security interest on that $2.7 trillion. That interest goes into Social Security. You can say it pays the benefit, but you can also say, wait a minute, if $2.7 trillion on some years, if the interest return is $150 billion on Social Security, and up until 2009, Social Security always took in more money than it paid out. So if they had $150,000 billion in interest paid by the government to Social Security, by law, had to take that $150,000 check and give it to the government so the government could invest again. So that circle went around and around. And second, Rush Limbaugh said the last 2 years when we had the Social Security tax holiday, which basically everybody who's got the paycheck already this year has realized the holiday's over with and they're getting less money. Well, what the federal government did was it borrowed the money, and I think the first year was like $180 billion. So it gave the American people, it was a backdoor stimulus which allowed people to have more money to spend. But by law, we had to put the money in. So the American government borrowed $180 billion. It might have been less. I've seen as low as 140. So we rounded off, average it out to 160. So the American government borrowed $160 billion, added it to the debt, and then paid it into Social Security Trust Fund for us who didn't have to pay Social Security. They did that for the 2 years. And then also, if you make, if you make more than $32,000, the federal government, you have to pay taxes on on incomes of $25,000. They must pay income tax up to 50. That's an individual, up to 50%. Couples $32,000. Half of an individual's or couple's old age benefit counts as income, and the taxes are paid directly back into the Social Security system. So, plain and simple, you're making a lot of money, you're collecting Social Security, you're going to be paying taxes on your Social Security. Social Security isn't tax-free, and well, for the majority of the people, the majority of the couples, the average for couples is $23,000, and basically, like I said, $14,000 for individuals. They don't have to pay taxes on their Social Security. I'm pretty sure they'd much rather be in a position where they could have to pay taxes because they would have a higher standard of living. But so Russia's wrong. If you make more than you and your wife makes more than $32,000, you're paying taxes on that money, and it's going into Social Security. If you're single, 25 and over, you're paying taxes, and that has to go into Social Security Trust Fund. The federal government is paying interest on that $2.7 trillion that it owes Social Security. That goes into the Social Security Trust Fund. And yes, over the last 2 years, the United States government basically added about $300 billion to our debt to put the money into the Social Security Fund. And so that's part of what Social Security is. And so people would, if you're on Medicare, it ain't all free. It's costing you money. And so you can also see this is one of the reasons why a lot of doctors won't take new Medicare patients, because the reimbursement is low. And I'm going to finish up real quickly. Again, the website godirect.org or the telephone 1-800-333-1795. You only got about 6 weeks to find out how you're going to do your direct deposit or your debit card, which by law has to go in effect March 1st, 2013. So jump on that one, and I'll see you out there on the long road. See, Ernie, it was a little bit better this week. And have a good day.